Lynn White's here to talk about something that a lot of you probably want to know about, and that's liposuction. Lynn.
That's right, sucking that fat out of that body wherever you want to. That's what's happening these days. More and more people are going for the lipo. Joining us now is Dr. Robert Guida. Welcome, first of all, to Good Day New York. This is sort of the craze in aesthetic surgery, is it not right now?
It is. Liposuction is one of the most popular procedures done around the country. I think it's the most frequently performed cosmetic procedure done in the United States today.
Okay. The first thing most people want to know is it safe?
It is safe. When it first became popular 10, 15 years ago, there were problems with too much blood loss and things like that. Now it's done under local anesthesia. There's very little blood loss, and it's very, very safe.
We have a tape, I believe, of the procedure itself, and I think we're going to show you where it's being done on the buttock area.
Right.
But people are having their thighs sucked out, their stomach sucked out, their neck sucked out. Is it, first of all, a costly thing, and second of all, is it painful?
The cost varies. If you have just the regional parts of the body done, it could run $1,500 to $3,000 or $4,000. If you had your whole body done, it could run several $1,000s. And in terms of the pain, most doctors around the country are using a technique known as tumescent liposuction. It's done under purely local anesthesia or local anesthesia with a little sedation, and there's not much pain involved, and afterwards the anesthesia lingers for several hours, so post-operatively or after surgery there's very little pain. And
you can get up and walk around the next day, go back to work?
Well, most people might not want to go back to work the next day, but you have to wear compressive dressings sometimes depending on the part of the body liposuction, and you have to limit your activities for several days, but you can be up and active shortly after the procedure.
Now, I know you lose inches, but do you also lose pounds as well?
Yes. You definitely lose pounds.
And is it dramatic in some cases?
In some cases it's dramatic. We have men and women that cannot lose weight or cannot get the fat removed from parts of their behind or their abdomen or inner thigh, no matter how hard they exercise. And liposuction seems to be one of the few reliable alternatives.
And one thing I know more and more people are doing, also women in particular, is they are taking the fat that they get liposucked out and putting it, injecting it in their faces.
Right.
Do you recommend that? Do you think it's a good procedure?
I think it's a safe procedure. I think people have to understand that when the fat is injected, it's similar to collagen in that it does not last. It is not a permanent thing. The fat resorbs over several months.
But it does get rid of the wrinkles and it makes you look younger.
Yes, it's one technique. Like collagen, fat injection is another technique to get rid of some of the wrinkles in the face.
All right, I think you've sold a few of us here on liposuction very soon. Dr. Guida, thank you so much.